If you have children this time of year, you have noticed that your mornings are much more manic than they have been up to this point. Not only is it trying to get everybody to school on time, trying to get everybody fed, the pets are involved too. And then we also have kids that'll bring things home, like their lunch that they didn't eat, and the pets can get into that too. So back to school toxins are really a thing.
Hey Vetfolio Voice friends, Dr. Cassi here with a great episode featuring Dr. Tina Wismer, director of the ASPCA Animal Poison Control Center, who joined me to talk about some of the common toxins around the house that may pose a risk to our pets, particularly during back to school time when routines change and potential hazards may increase around the house. We talked about specific toxins like ADHD medications, chocolate, grapes, and even illicit drugs like marijuana, which, as we know, are becoming more readily accessible. And Dr. Wismer explained why the incidence of these intoxications tends to spike during this season and shared practical recommendations for communicating with our clients about how to prevent pets from becoming exposed to potentially dangerous substances. By the way, you'll hear it in this episode, but if your pet has ever had an incidence of dietary indiscretion and that stresses you out to think about it, I'm here to make you feel better. In college and vet school, I had the Rottweiler who ate everything. I shared a few stories here, but emphasis on this being just a few stories. That dog ate so much stuff. I swear, even when I was standing right there with him. And then he taught my other dog his tricks for getting into everything, and together, let's just say they made quite a pair. So if you've ever felt guilty about your pet getting into something they shouldn't, and you're beating yourself up going, gosh, I shouldn't have let him do that, just know I can relate on so many levels. Anyhow, I know I digress there, so let me get back on topic here. We also discussed the importance of client communication when it comes to keeping pets safe. We talked about how to educate pet owners on the risks and preventative measures to help avoid these emergencies. And for those situations where prevention might not have been enough, we talked about critical first steps to take when presented with a possible toxicity case. We covered diagnostic and treatment approaches for when we know exactly what that pet got into and how to approach cases in which we suspect toxicity but maybe can't pinpoint exactly what that pet got into. And as we learn in this episode, back to school time can certainly be a time of increased risk to our pets, so let me introduce Dr. Wismer and let's talk about it. Dr. Tina Wismer is the Senior Director of the ASPCA Animal Poison Control Center. She earned her undergraduate degree from Ohio's University of Findlay and received her DVM from Purdue University. Dr. Wismer worked in both small animal and emergency practice before joining the ASPCA Animal Poison Control Center in 1998. Dr. Wismer is a diplomate of the American Board of Toxicology and the American Board of Veterinary Toxicology. She's an adjunct instructor at the University of Illinois, a visiting professor at St. Matthew's University in the Grand Cayman, a consultant for VIN, and a master gardener. All right, let's go ahead and get into this episode.
Nutrition is the cornerstone of our patients' health and happiness. The veterinary healthcare team should be the ultimate source for top-notch pet nutrition info. When clients see how the right diet helps their pets stay healthy and happy, they visit us more often. Remember, good nutrition is essential. It's smart business and great medicine. Enroll in the NAVC Pet Nutrition Coach certification today on vetfolio.com.
Well, I'm really excited for this episode to be joined by Dr. Tina Wismer of ASPCA's Animal Poison Control, and we're going to talk about back-to-school toxins, which I have to say, when I think about the topic, toxicology, if you say, Cassie, let's talk about toxicology, thinking of back to school as its own category is not a category I would have organically come up with myself. So I'm really interested to hear what kind of calls you're getting around back to school. So I thank you so much for joining me and kind of reviewing this category of toxicities.
So if you have children this time of year, you have noticed that your mornings are much more manic than they have been up to this point.
Isn't that the truth?
So not only is it trying to get everybody to school on time, trying to get everybody fed, the pets are involved too. And then we also have kids that'll bring things home, like their lunch that they didn't eat, and the pets can get into that too. So back to school toxins are really a thing.
You are describing my morning for sure. This morning, I was definitely threatening to send my daughter to school in her nightgown. She did not go to school in her nightgown. She did finally manage to get dressed and, in a frustrating turn of events, I'm pretty sure was ready before I was, but, here we are. But absolutely, getting home, my kids being a veterinarian's kids know very well if they open that lunchbox and there's something like grapes or something in there to keep that away from the dogs. But I could imagine if that wasn't something that I experienced on a day-to-day basis and wasn't top of mind, it would be really easy to have kind of some slip ups and have dogs get into something that you might not realize is problematic.
Yeah, until you get that routine down in the morning and when they come home, it can be pretty dangerous for your pets.
So, what are some of the most common toxins that you get calls about at back to school time?
So in the morning, we have a lot of calls about pets eating children's ADHD medications, right? It's back to school. We tend to start them back on their medication. You know, sometimes parents will leave it on the plate and the dog will get a hold of it that way, or children don't want to take their medication and they hand it off to the dog, but mostly it's dropped pills. So when we think about ADHD medications, these typically are amphetamines. In children, right, calms them down, makes them focus. In dogs and cats, it does the opposite thing. They're agitated, they're tachycardic. If they get enough, we can actually see tremors and seizures. So it certainly can be a problem depending upon the dose and the size of your pet.
That makes sense. Another one of those that stays top of mind for me as a veterinarian is it's not my kids taking the medication, it's me. But something that I'm really cautious with because, I've seen these dropped pill cases and these toxicities in dogs, but, putting myself in someone else's shoes, if it was my children, even as a veterinarian who knows better, I could see myself making that mistake. I'm thinking of even just last night, my husband, that he was going to eat a salami sandwich and he put it down on a paper towel and went to do something else. And you can imagine that salami sandwich was not there when he got back. So it seems like it would be very easy to, like you said, put something on a plate or, drop something and have the dog pick it up before you even realize what happened.
Right. And if you have pets that are on medication, I mean, how many times have you grabbed your pills and the pet's pills and you give the pill and you think, oh gosh, which one's still in my hand? Okay, good, that's mine, right? So we do have animals that are exposed to, cardiac medications or diabetes medications also this time of year because, we get busy, we don't focus, and then unfortunately problems can happen.
I had a poor client that happened to. Fortunately, it was just Benadryl. She didn't give the dog her pills, but she took the dog's pills. Unfortunately, it was just Benadryl, but they both had a really good nap after after that vaccine appointment.
Yes. And people are never concerned about themselves when they do that, right? They're always concerned, oh my gosh, I gave my medication to the dog. And
Right.
sometimes you're like, well, let's talk about you. You need to call human poison control.
Yeah, yeah. Like this could actually go south for you. We should be concerned about everyone involved here.
Exactly.
So we've kind of talked about lunch boxes a little bit, thinking of grapes. I'm curious to know if there are other lunchbox toxins that you get calls about regularly, ADHD medications, any other, kind of common toxins that you're seeing.
Sure. When we think about lunchbox, as you said, grapes and raisins are probably the most common that we have pets getting into. And it is just a problem for dogs. But as a child, and actually as an adult, I'm not very fond of raisins, right? So my mom would send me the little box of raisins, and if I couldn't trade them for something else, I would bring them home. And pets can get into them that way. So we know with dogs that any more than one grape per 10 pounds or one raisin per 10 pounds puts them at risk of kidney failure. The toxin in grapes and raisins is tartaric acid, and it is something that we find in various amounts depending upon the type of grape or raisin. Those cotton candy grapes, right, the ones that are really sweet and delicious, those actually have much higher levels of tartaric acid than your typical green Thompson seedless table grape. So we want to avoid our pets getting into that. So it's training your children, right? If you don't eat all of your lunch when you bring it home, right, it goes in the fridge or someplace like that where the pets can't get into it.
And sometimes I think with having a lot of information readily available about what foods pets can and cannot eat, and, kind of having this knowledge top of mind in the veterinary industry, we might take that knowledge a little bit for granted. Like I said, I've trained my kids from a young age. If you have grapes or raisins, you need to keep those far, far away from the dogs. And we've talked about that with other potential toxins too. But it sounds like we really need to be making sure that we are educating pet owners to say, hey, this is really, second nature and top of mind for me, but let me make sure you know to be aware of this.
Yes. It's those things that are not a problem for people to eat that are a problem for pets is where we run into trouble. We've known for years, and we've been educating the public for years about chocolate, right? So people know chocolate is toxic for dogs. But, grapes and raisins is still relatively new. And xylitol, which is that sugar alcohol sweetener, also is pretty new. So, some people don't know about that, and pets can get into problems.
One area I've been worried about xylitol with my own pets. My pediatrician recommended that I give my kids a multivitamin every day. And, my kids are typical and they want the gummy multivitamins. I have no idea if they actually do anything, but, I'm a rule follower and I'm doing what I'm told. But that's been one area I've really been a label checker of if I'm giving them these gummy vitamins and they drop one, what are the chances of xylitol toxicity? So that was one I didn't expect to be worried about, but I am.
Yeah. So any medication that's chewable or that is made to dissolve quickly in your mouth does have a risk of containing xylitol because, if it tastes horrible, kids aren't going to eat it, right? I don't want to eat it either. But yeah, we can find xylitol hiding there. Our biggest exposure to xylitol is through sugar-free gums, right?
Sure.
Because for people, xylitol is great. It decreases cavities, it decreases the risk of ear infections in children because the bacteria can't use that sugar to reproduce. So, people, it's fine. But in dogs, orally, it actually causes an excretion of insulin, right? So your pancreas is activated and your blood sugar drops. So we can see animals having, tremors, seizures, even becoming comatose from their blood sugar dropping. And unfortunately, in dogs, it also affects the liver. So we can see acute liver failure if they get enough xylitol.
And I feel my role here partially is just to make anyone out there whose dog has ever experienced a toxicity feel better. I shared about the salami sandwich, but would you believe my dog was out in the yard one day and I looked out in the yard. I don't know. She must have grabbed it off like an outside table or something. I saw her like systematically dismantling a pack of Trident. It comes in like the little blister packs and taking each individual piece of gum, and she ate an entire pack of Trident sugar-free gum, and I had a panic attack.
Right? And when it comes to the amount of xylitol in things like gums, it can really vary. So where xylitol is on the label definitely plays a role into how toxic it is, right? The higher up on the label it is, the worse it is.
Absolutely. Absolutely. Along the lines of xylitol, sugar-free gum candies, things like that, I think we might be a little bit remiss here too if we didn't acknowledge there are some other gummies that can contain maybe more than just sugar or xylitol that we should be aware of with our pets.
Are you thinking of the illicit or recreational gummies?
I believe I am. I believe I am. I think they contain, some substances that dogs may be a little extra sensitive to.
Yes, yeah. So THC containing gummies, we do have a lot of dogs that get into those. With cats, it's still plant material, right? They're eating, the flour out of the baggies and that type of thing. But dogs and edibles, oh, right? They seem to not be able to get enough of it. And the problem with these is, you or I can read the label and see that one gummy is a dose or one bite of the chocolate bar or one bite of the brownie. But we know dogs don't read labels, and whatever serving size it is, right, that's just one serving for them. So they're going to eat to the end of the panda brownies, to the bottom of the bottle of gummies, and become intoxicated. So it is a matter of dose with these cases.
I have so many stories here when you say not about my dogs eating that. Like, no, my dogs did not get into marijuana gummies. Let me just clarify that. But when you talk about whatever the serving size is, that's how much they're going to eat. Oh, yes. Like anybody whose dog, has had a dietary indiscretion and you feel guilty about it, you just give me a call because I have all the stories about my troublemaking canids that live in my house.
Yeah. So, we used to always kind of, I shouldn't say make fun of animals that got into marijuana, but we used to joke, oh, the treatment is, right, Pink Floyd and Doritos, right? You would just monitor them on fluids, they would do great. But with these huge doses now, because things are much more concentrated, we can see animals developing not only the classic triad of signs, which is the lethargy, hyperesthesia, and urinary incontinence, but also some of these animals will become hypotensive and comatose. Death is very, very rare, but it can occur. So if these animals can't respond to their name, they can't walk, they need to be hospitalized and have their vitals monitored.
I think you make a really good point there of it's not a stash of plant material necessarily that these dogs are getting into, which may be a little bit lower dose of the THC that's really going to be problematic for them. But you're right, in these gummies and these chewables, edibles, that we're going to see a much higher dose in a much smaller serving. And so where yeah, like you said, we used to not worry about it as much and say, let them sleep it off, it'll be okay. There's a potential for a much more severe toxicity here.
Exactly. And of course, edibles with chocolate are very, very common. So not only do we have to worry about THC, we also have to worry about chocolate intoxication.
There it is. Huh. And I had a colleague point out to me as well, pancreatitis. If we have these dogs that are very prone to pancreatitis and it's a plate of brownies or butter or something like that, then other comorbidities we may need to be on the lookout for.
Yes, especially in those breeds like schnauzers that are very prone to getting affected with pancreatitis. Now, if you want to talk about gross stuff with marijuana, I got something for you.
Always.
Another way we see pets being exposed to THC is through human stool. Okay.
Oh.
Yes. So, dogs eat anything, right?
Uh-huh.
So these are typically people who live next to parks or hiking trails, and, right, their dogs run off leash. They eat the human stool. And with people that smoke or ingest marijuana, about 85% of the metabolites that are passed in the stool are still active. So dogs can actually become intoxicated from eating human stool. There's actually a great paper out of Melbourne, Australia, that talks about this. So yes, it's gross, but it happens.
I can definitely say that I learned today. I don't know if it's something I wanted to learn today, but I definitely learned today. Oh my goodness.
Oh, yeah.
Huh. Well, thinking as a general practitioner who, oftentimes we're kind of that first phone call of the dog got into something, owner picks up the phone, calls the vet, hopefully, and says, hey, this is what my dog got into. What do I do? Oftentimes, I will immediately make the recommendation to call poison control or bring them in and I'll call poison control. And we're going to get poison control involved and we're going to figure out what the best thing is to do. Kind of in that context, I guess my question would be with some of these more common toxicities that we see around back to school time, what recommendations would you have to just immediately be aware of? Like when we hear ADHD medication or grapes and raisins or THC, where we can already have the ball rolling as we're getting on the phone with poison control and going, okay, walk me through this. What do I do?
Yeah, so it's important to ask the owner some questions. Tell me about the dog, right? How old is it? How much does it weigh? Does it have any health problems? As you mentioned, comorbidities. This can really change the amount of a toxin that it takes to cause problems, right? If you've got kidney disease and the toxins excreted through the kidneys, right, we may have to treat them for a longer period of time. We also want to know about any medications that the animal is on, because once again, those can interact with whatever toxin could have been ingested. We're also going to want to know, how long ago did this happen? We get a lot of, oh, it happened last night. And you're like, and how's the animal, right? So we want to know what they're doing right now. Are they totally normal, or are we having problems? So all of those go into making an assessment. So either having the owners call or come in right away, especially if they're symptomatic, then you can get more details and give us a call afterwards.
That makes a lot of sense, of really asking those clarifying questions with comorbidities, but also keeping in mind kind of the principle that toxicity tends to be very much dose related. Anything can be a toxin in a large enough dose, and there's different kind of thresholds there. So really making sure we know how big is this animal and how much did they get into. Are there good questions that we can ask to help discern the amount? Thinking of getting these phone calls and you say, how much did they get into? And it's, oh, a 2-inch by 2-inch brownie, or it's, I'm not sure how many pills, but it was, you know, more than 2 and less than 5. And, so are there ways that we can kind of massage that conversation to get a little bit better picture of what the dose is that this animal ingested?
Yeah, so when owners initially call, they tend to be panicked, right? Oh my gosh, my dog ate pills, right? Or my dog ate a pan of brownies. So with pills, you'll say, how many could he have eaten? And they'll be like, I have no idea, right? I don't know. I don't know. So it's about asking questions. Well, how big was the pill vial, right? How many did it contain when it was full? And maybe they say, oh, it's 30, it's a month supply. Okay, how long have you been taking those pills? 2 weeks. Are you good at taking your pills every day? Yes. Okay, now we're thinking worst case scenario is maybe 2 weeks worth of medication, so maybe 15 pills. So we always go worst case scenario. When we get to things like chocolate cake and brownies, it becomes a lot more difficult. If they made it themselves, it's easy, right? Hey, what's the recipe? But if not, then we kind of estimate, okay, when I make a triple chocolate layer cake, let's go on the internet. Oh, look, it typically takes a cup of cocoa. Okay, so we'll do worst case scenario. So sometimes it's a lot of like using Dr. Google to find out some answers. But yeah, we always do worst case.
That makes sense to just ask your questions in a different way, which we have to do, it's a skill we develop in general practice anyway, but really centering that very specific question asking around toxins.
Yeah. And, you'll have people, that are like, well, why are you asking me, if he's on medications, he ate, my heart medication. So you have to explain why, right? Hey, these can interact with some other meds. Just want to make sure he's not on anything because that can make it more dangerous. So, and then they'll usually are like, oh, okay, right? They don't realize what we need to know. And they're panicked, right? Because everyone's
Yeah.
worried. And the thought that's just going through their mind is my dog going to die? Is my dog going to die? Is my dog going to die? Right? So until you answer that question, they can't focus on what you're saying. So it's a lot of, okay, great. I'm going to get this information. We're going to assess the risk. And, at this point, your dog is stable, right? Or at this point, right, we're worried about his blood pressure, be honest with them. But yeah, you need to get them to focus. And sometimes it's an art in doing that.
Honestly, though, I mean, you guys over at Poison Control are you have that art down very well, because I know that even happens to me as the veterinarian who's calling in and I'm like, oh my gosh, and they ate this and I'm so worried. And, are
Mhm.
they going to die? And what do I need to be doing right now? I need this information right now. And I've had Poison Control kind of talk me off the ledge as the provider and say, okay, it's just like this very like relaxed, cheery, like, okay, nope, I understand. Yep, let's talk about these couple of things and I'm going to get you some information. We're going to get a treatment plan started. And there's so much confidence and there's so much calm in that phone call that's why as soon as I get that toxicity phone call, I'm like, we're going to make another phone call.
And that's the advantage we have, right? This is all we do. I don't have to clutter with my mind with how do I treat a DKA, right? What do I do with that cushion-oid dog, right? That's your purview. Poisonings, I'm your girl.
And it comes across so clearly, and it's such a necessary service that I know at least I'm very thankful for.
Thank you.
So along those lines of things that we really should be thinking of, what about kind of the opposite situation where we have an owner calling and saying, my dog is acting funny. And you say, well, did they get into anything? Well, I don't know. They were out in the yard. We took a walk in the park. Hopefully they didn't eat human stool. Oh my goodness. But so they don't know what their dog got into. And we're trying to drill down on those possibilities of what could be wrong with this dog because it's presenting like a toxin. Are there certain cues that we should look for or, probing questions that can help us get that answer?
Yeah, so a lot of times the questions are going to be about the animal's environment, right? What have they been doing the previous, few hours before they develop clinical signs? Was the animal vomiting last night and this morning, right? It's having tremors, right? It's going to lead you to think of other things. It's a big differential list. We don't want to forget about things that are, infectious or metabolic, but yeah, toxins are out there. And when you think about, okay, he's in a fenced backyard. What's in that fenced backyard? What kind of plants? Have you used any insecticides lately? Are there mushrooms? Is there a compost pile, right? Compost piles are great for growing molds that make tremorogenic mycotoxins, right? So you see that dog come in and he's tremoring all over and you're like, hey, any moldy food? And they're like, well, I don't think so. And you're like, okay, do you have a compost pile? Any fruit or nut trees that are dropping fruit this time of year? And they'll be like, hey, yeah. And that can kind of lead you to your cause of our clinical signs. But if we don't know, just like any other case, you're going to treat the clinical signs, right? Blood pressure is low, you're going to bring it up, right? They're tachycardic, you're going to lower the heart rate. Doesn't matter what the cause is. We just need to treat our patient.
Are there any major contraindications where you're like, you should always be cautious before you implement X, Y, and Z treatment? You should really have this information before you feel comfortable giving this medication or whatever treatment it may be?
Yeah. So the one that I think about is amphetamines, right? Our ADHD medications. Our dog is agitated. A lot of us reach for benzos, right? We're going to give our dog Valium or midazolam. And a dog becomes more agitated and, more hyperesthetic. I shouldn't say it's kind of a good diagnostic test, but, right, if that dog becomes very agitated, you're going to say, hey, any amphetamines in the house? And then you're going to go ahead and reach for your acepromazine or other phenothiazines, which are the more appropriate therapy. So as long as you give the correct medication, they do well. The only other one I can think about is these isoxazole mushrooms that can grow in the backyard. And these cause these strange waxing and waning signs, right? Animals are agitated and then they're really depressed. And then they're very agitated and then they're really depressed. So when they come to you in the agitated stage, once again, what are you going to do? You're going to give a benzo. Well, unfortunately, with isoxazole mushrooms, they tend to stop breathing if you do that, right?
Oh,
So, oh crap, right? Now I have to intubate and ventilate. So, as long as you are monitoring your patients, we can get over these quote unquote contraindicated medications, right? We don't know what we're treating the clinical signs. Okay, something bad happened. We're going to address that and then move on.
see, this is why I love poison control because you guys are just so calm about it. Like if I gave a benzo, which is generally considered a pretty safe drug, and my
Yeah,
patient stopped breathing, like I think I would stop breathing and
right.
be like, oh my gosh, I killed him. Like, what's that? But then I call poison control. You're like, it's fine. You're gonna intubate him, you're gonna do this. Now, along those lines, I'm picturing myself in this scenario. And so I give a benzo, my patient stops breathing, I stop breathing. Hopefully I start again and think about what to do. And we get him intubated, we're ventilating. Then my thought would be, okay, well, let's give flumazenil. Let's reverse this. But
Mhm.
I know I would have a moment of pause going, well, shoot, like this is already a toxin. I already gave
Mhm.
one drug that made it worse. Do I
Mhm.
give another drug that makes it worse? Are there any of those reversals where you're like, that actually could be a bad idea?
Actually, none that I can think of. So, right, if
Awesome.
you're going to treat your sign, right? Oh my gosh, I gave benzos, he stopped breathing. I'm going to reverse it. So, yep, that works well. There's several medications out there that are alpha 2s, right? We have eye drops that are alpha 2s. We have nasal sprays that are alpha 2s. So these animals come in, right? They're bradycardic, they're lethargic. You give them antecedent, atipamezole, and ta-da, you're the hero. It works really well. Kind of just like reversing an opioid with naloxone. It's amazing, right? You're the hero.
We have nasal sprays that are alpha 2s.
Yes, yes. A lot of the ones that contain things like oxymetazoline or tetrahydrozoline, those things that shrink your nasal tissue, right? Stop you from having
Wow.
runny nose or red eyes. Those are alpha 2s.
I learned more than just the really gross facts today. This is so interesting. Another question that's coming to mind as we're talking about this
Sure.
is, we talked about a benzo in particular and how with an amphetamine, and I'm assuming with a methamphetamine as well, if this was like an illicit drug where, I've heard of lots of cases of it being thrown over the fence or something
Hmm.
like that, that our benzo is going to make things worse. With these mushrooms, they're going to stop breathing.
Hmm.
Does it make more sense if we do have an agitated patient to reach for something like ace-promazine first, assuming we have a stable heart rate, stable blood pressure?
Yeah, as long as your heart rate and blood pressure are normal, you can give low dose ACE, right? Like 0.025 mgs
Okay.
per kilo, and you should be just fine.
That is like medium
Yeah.
dose ACE for me, so
Okay,
I'm perfectly happy
0.01.
with
How about
that.
that?
I will start there and work my way up, but 0.025 gives me a nice
Exactly.
little range to work with.
Yeah.
Oh, perfect, perfect. Gosh, I love these toxicity podcasts, these toxicity discussions because there's so many different toxins and they're all a little bit different. And so much to learn and so much that I immediately take away from these discussions.
Working at poison control, it really colors your view of the world, right? Because literally everything is toxic. As you said, its dose determines the poison. Too much oxygen, too much water, right? Too much ibuprofen. All of those can be toxic in the right doses.
Absolutely. And I think that's something that I try to keep in mind what you said about, dose determines the toxin and also one of the biggest challenges that I find of kind of drilling down to how much of something this animal actually ingested. And I love that framing of the questions. I think that's really helpful to try to get a little bit better idea of what we're looking at. I also didn't know about the one grape or raisin per 10 pounds. I always thought it was just some dogs are more sensitive than others. So one grape, one raisin could be okay, or it could put them into kidney failure. It sounds like that's still the case, but kind of that one per 10 pounds is a good panic, don't panic type
It
of.
is. It is. So, that Maltese eats one grape. Yeah, it's probably a problem. The Labrador eats one grape. We're golden, right? It's not going to be a problem. Basically, we've kind of determined these doses by going back and looking at data on thousands of cases. Okay, where was a problem? Could the owner estimate how many were eaten? And we also know that sometimes owners give a bad history. Oh, my toddler was feeding the dog grapes. He only got 3. And you're like, well, let's induce vomiting, right? And you get back like 5 or 6. And you're like, they weren't reproducing in the stomach, so bad history. So is it going to hurt to induce vomiting? In most cases, no, it's not. But we do know that dose of concern now is greater than 1 grape or raisin per 10 pounds. To make it a little more complicated, because vet med is never black and white, if those raisins are cooked, right? Raisin bread, oatmeal raisin cookies, then our dose of concern is over 2 raisins per 10 pounds. So we know that tartaric acid, which is the toxic compound, is denatured by heat. Now, it's not totally made non-toxic, so we still need to decontaminate them, but it's about twice the amount where we start to get concerned.
I'm furiously scribbling notes here. Uh,
Rewind. We're going to
yeah,
rewind,
no,
listen to it again.
I told that I remember doing an episode with a neurologist one time who was just a wonderful guest, and he was walking us through seizure workups, which can also be kind of vague and confusing sometimes. And I told him, I was like, hang on, let me write that down. He's like, we're recording this, right? Oh, I said, yeah, but then I have to listen to my own voice. Let me just write it down right now.
Right? I still like pen and paper. Mhm.
Yes, absolutely. Absolutely. Well, you touched on a question that I know crosses my mind when I'm dealing with a toxicity case on a regular basis. And you mentioned inducing vomiting. And decontamination is always a question for me. Like, do I induce vomiting? Do I not? Do I give charcoal? Do I not? Am I going to increase absorption somehow unwittingly? So, do you have some quick and dirty tips for decontamination?
Sure. So the most important thing is when was it ingested and what was ingested? So for things like pills, most of these you need to induce vomiting within about the first hour, right? Because otherwise they're going to be absorbed. Now for things like ibuprofen or acetaminophen, we get blood levels within 10 to 15 minutes. And think about it, right? Do you want to wait for an hour for your headache to go away? No, right? I want it to go away now. So they're absorbed very quickly. Things like rat baits, right? Rodenticides, those will hang out in the stomach for about 4 hours. Chocolate, about 8 to 12, and raisins also about 12 hours. So you've got plenty of time to induce vomiting with chocolate, grapes, and raisins. The charcoal question, right? That's always the big one. To charcoal or not to charcoal? And what kind of dose could we have ingested? What kind of clinical signs are we expecting to see? If these are clinical signs we can easily control with medication, right? Like those amphetamines, they respond great to acepromazine. So probably wouldn't charcoal those guys. Now, if we're over a lethal dose of something, then yes, we're going to probably reach for charcoal if we're past that point where we can, induce emesis. So we use charcoal much less frequently than we used to because charcoal's not benign, right? There's the risk of aspiration because of the volume you're giving. There's also a risk of hypernatremia because charcoal is full of osmotic agents and it's going to pull free water into the digestive tract, right? So we don't want our animals to tremor and seizure from what we've done to them, right? That's always a bad thing. So emesis and charcoal, it is a patient by patient decision.
Okay, and that makes me feel better about not just knowing off the top of my head if I should give charcoal, because sometimes, I'm kind of kicking myself going like, is this a charcoal case? Like, am I supposed to do that? And and I never know for sure. I always have to do a little bit of thinking, a little bit of looking. So it sounds like that's kind of the right approach if you really need to look at it holistically and then make that determination.
Exactly. Yeah. If you ingested a medication and it peaked, in 2 hours and we're 4 hours down the road and our animal is only mildly symptomatic, there's no need to put you or your poor technicians or the animal through giving charcoal.
Sure, sure. Yeah, it's no fun for anyone. I really like hats off to technicians giving charcoal. I've only had to give it a couple times in my career because I've worked with wonderful technicians who when I say like I think we need to give charcoal, I say it kind of quietly and I stand back in the corner and I've worked with wonderful people who are like, "Yep, we know how to do that. No problem." I'm like, "Oh, everyone's okay with great. I'm going to go over there and you just let me know when charcoal's in." And then of course everybody comes back like covered in black finger paint and it's a big mess. And but yes, I worry about the aspiration issue and the hypernatremia and and water deficits if we're causing diarrhea or something along those lines. So some of that's gone into my thinking of I'm not always sure if I should give it or not. And I think what you said right there is very reassuring.
Yeah. We used to give a lot more charcoal, but we now have a lot better drugs and more drugs that we have access to treat these animals. So the incidence of giving charcoal has decreased.
I think that's probably a good thing for everyone involved.
Yes.
Um, well, Dr. Wismer, I so appreciate all the information. I've learned so much just from our short talk here. As we wrap up, I'd also love to talk to you about prevention, since this is something that is so common. Do you have any good tips that you've come across of just how we can help educate clients on how to prevent these toxicities?
Yes, as like you said, as veterinarians and as pet owners, right, we're pretty up on not leaving things where pets can get them. But with the beginning of school, you've got backpacks, or maybe you've got friends or relatives coming over. Grandma may not know not to put her purse on the ground. Grandma's purse is probably one of the worst things dogs can get into,
Right.
right? You've got medication, you've got xylitol gum, you've got
Yes.
acetaminophen. Yeah. So definitely, not only do you have to train your own family, but you also have to train any visitors that come over, right? Hey, we've got a dog. Let's put your purse, up here on the counter where they can't get to it.
That makes a lot of sense, just from the very start of our conversation, thinking about the grapes and raisins toxicity, and I'm like, well, from the time my kids could understand, I was telling them keep that away from the dogs, and they're very aware of when they're eating those kinds of foods now. And also, I love the question. I don't mean to turn this into Cassie story time, but I really have like way too many dietary indiscretion stories. I always love the question I get when they're like, they yell across the kitchen, "Mom, is such and such bad for the dog?" Which means the dog already ate it. They just
That's
need to know
right.
how much trouble they're going to be in. But it really is that
Mm.
constant communication, that proactive approach of, hey, you really need to be cautious about your dogs around this, that starts those healthy habits in motion to just automatically be aware when you're handling different toxins and keeping them away from pets.
Yeah, and your new puppy is not your old dog, right?
Right.
Old dogs are great. They're so much better behaved. Puppies, ugh, they make them cute for a reason because
Yeah.
otherwise you would kill them.
Yes.
So yeah, you'd have to definitely puppy-proof your house again.
Why do we have to learn that over and over again each time? You'd think we would figure it out, but every time I'm like, why are you so bad? Oh, yeah, because you're a puppy.
Yeah, it's the oxytocin and dopamine that make us forget, I think.
I agree. I agree. We'll go with that. Uh, well, Dr. Wismer, this has been a lot of fun and so educational. I really appreciate you joining me. And we have a couple more of these in the works, which I'm super excited about because I really do learn a lot when we sit down and dissect these cases and these principles around toxicology. So I want to say a huge thank you for joining me and ask, are there any other final thoughts you want to share with us?
Don't panic, right? Make sure that you have good conversations with your owners. Prevention is key, but if animals get into things, right, it's typically accidental, and we're going to ask those questions and be able to treat our patient.
I think that's such a good take home message. Thank you again for everything.
Oh, you're welcome. Thanks for inviting me.
Man, after talking to Dr. Wismer, it is so clear why back to school time can really be such a hazardous time for our pets. I really never thought about it, but she did such a great job of laying it out here. So I hope everyone joining us learned as much as I did in this episode. Dr. Wismer, thank you so much for joining us, and a big thank you to the ASPCA's Animal Poison Control Center for making this episode possible. If you enjoyed this episode, please leave us a 5-star review wherever you get your podcasts. It'll help other veterinary professionals like you find this and other great content we try to put out there. For more episodes like this, click on the Education tab on the Vetfolio website. As always, we'd love to hear your input on this talk, as well as ideas for topics you'd like to hear from us in the future. Feel free to reach out to me at dvm@vetfolio.com. You can also visit my Facebook page at Dr. Cassi DVM, and you can find me on LinkedIn. And remember, if one animal is better off because of you today, it's a great day.